Imagine a love so strong that saying hello and goodbye on the same day was worth the sorrow. You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Dr. Stacy Orloff. Dr. Orloff is Vice President of Palliative and Community Programs for the Hospice of the Florida Suncoast in Clearwater, Florida, and co-chair of the Children's Project on Palliative Hospice Services, CHIPS, a program of the National Hospice and Palliative Care Organization. Dr. Orloff, welcome to the Clinicians Roundtable.
Thank you.
What is perinatal hospice?
Perinatal hospice is a specialized field within the hospice and palliative care movement. It's interdisciplinary, holistic care for families who are facing pregnancy loss.
Who makes up this team?
Well, the teams really vary depending on the programs across the country. It typically involves shared staff between the hospital and the hospice, so it may include labor and delivery nurses, a hospital chaplain or a hospice chaplain, volunteers, perhaps a hospice or a hospital counselor who's there to provide some support.
When an unborn child has been diagnosed with a terminal condition, what support is offered by the perinatal hospice team during the pregnancy?
Again, that may vary according to the program around the country. Typically, though, hospices that say they offer a perinatal loss program would have counselors available to support the family prior to the labor and delivery.
Describe the program at your hospice.
Well, we think we have a very unique program in that, in addition to the positions that I've already discussed, we also utilize specially trained doulas. And many people may know what a doula is, although perhaps not everyone. A doula is a birth coach who is there to assist the mother to ensure that her labor and delivery goes as she'd like for it to, as best as it can be planned. And the doulas that we work with have been trained especially in perinatal loss issues. So in addition to the hospice nurse, the hospice counselor, the hospital staff that I've mentioned, our doulas are also present. If a family knows ahead of time that their delivery is going to result in a loss, then the doula may work with the family prior to the labor and delivery and help the mother develop a birthing plan specific to her. And then she will be present throughout the labor and delivery at the hospital to provide the support to the mother. If the mother would like to receive counseling prior to the labor and delivery, our hospice counselors can provide home-based support throughout that pregnancy, providing support to the mother, birth father, extended family members, and any siblings if there are some. We also have another unique part to our program in that some of our nurses are also amateur photographers, and so frequently a lot of the families that we provide care to request that our nurses come and take pictures. Some families in particular have thought this well out and let us know what kinds of pictures they want. For others, the nurse just, takes pictures as best as she thinks. And this is often, just a wonderful remembrance for the family to have after the death. Also, we have some wonderful hospice volunteers who do some sewing circle work for us, and they hand make clothing that we give to every family after the delivery and death so that they have some burial clothes. Many times these perinatal losses occur prior to a full-term delivery, so that the babies are quite small. And so we have many outfits that are lovingly sewn for us by our volunteers that may be the size of, say, for a 1-pound baby, or if you think of a 16-week, 18-week pregnancy. And they're specially designed materials so that they won't tear the very fragile skin of a preterm delivery also.
What support is offered for siblings?
That really varies according to what the family would like. Again, we have the opportunity to provide counseling support to the family as soon as we become aware of them, and they are aware of either a pending loss, if it's pre-delivery, or certainly bereavement counseling post. The counselors can work with the siblings in their home. We're also able to provide some clinical support at the child's school, at the hospice service center. The siblings are also able to attend any of our support groups, and we have an annual bereavement camp that they also could attend.
Give us an example of a birthing plan as it relates to perinatal hospice.
Well, it might be something as simple as the environment in the labor room. It may also include things such as how the mother would like the baby to be bathed and washed and dressed afterwards. Our doulas, again, because of their training and the close work we do together, have a lot of different materials they'll bring with them. As an example, we frequently will bathe the baby after birth in a lavender wash, which has a very nice smell and is very easy on very fragile skin. And so the doula will talk with the mother prior to, if at all possible, to ask if she would like that, if she would like to have some clothing or some swaddling blankets, and also what kind of time she might like to spend with the baby after the labor and delivery. Hospitals have been very accommodating for us and certainly allow the mother and extended family members to have as much time as they need to hold the child before, the hospital protocol would kick in as far as getting the body to the morgue and things such as that.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Susan Dolan, your host, and with me is Dr. Stacy Orloff, Vice President of Palliative and Community Programs for the Hospice of the Florida Suncoast in Clearwater, Florida, discussing perinatal hospice. Dr. Orloff, what's the difference between a doula and a midwife?
Well, the doulas are there to provide support to the mother. They provide emotional, spiritual support. They are not acting as medical staff during the labor and delivery. So they're not providing hands-on medical care to the mother. That's the responsibility of the labor and delivery nurse that is present, or the midwife who is there to actually deliver the baby. So she doesn't lay hands on the mother except perhaps to wipe a sweaty brow or something such as that.
Do you know the type of training that the doulas go through?
Well, there is a certification process for a doula, and I think one of the misnomers that many people believe is that you must be a registered nurse to be a doula. And that is not true. However, the vast majority of doulas do happen to be RNs. Currently, the doulas that we work with in our program are all RNs and have had extensive experience in labor and delivery, and then again have all gone through the additional perinatal loss training that we provide, which is an 8-hour training. We are considering, as our program has grown over the last couple years, to expand the doulas that we'll work with, including those that are not registered nurses.
Does the perinatal hospice team help families with funeral and memorial service planning?
Certainly, that is a vital role in particular that our pediatric counselors can provide to the families. Sometimes the counselor is not made aware of the family, or the family may not request counseling services until after the pregnancy loss. In those cases, if it's the doula that may be talking with the mom and dad or other extended family members about funeral arrangements, then the doula will often call and speak to one of our counselors so that she has access to up-to-date information.
How can listeners learn more about perinatal hospice?
Well, they can go through the NHPCO website, which is nhpco.org, to access our CHIP site. They can also contact me if they would like for additional information on our program. And there is one national association called the Pregnancy Loss and Infant Death Alliance, which their website is www.plida.org.
And how may listeners contact you?
My email address is my first and last name, STACYORLOFF, like Frank, at thehospice.org.
Dr. Orloff, thank you so much for joining us to discuss perinatal hospice.
My pleasure. Thank you.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions at reachmd.com, which now features on-demand podcasts of the ReachMD library. Thank you for listening.